Hello friends, I am Dr. Ashish. Welcome to my channel Live Biochemistry. Today we will discuss about the hemoglobinopathy. The most common hemoglobinopathy is sickle cell anemia. And why it is called sickle cell anemia? Because in this condition, the RBC turns to the sickle cell. This sickle shape, this is a sickle. Okay, and RBC turn instead of biconcave shape, it convert to sickle shape. So this instrument is used to cut the grass in agriculture, and RBC becomes sickle shape. That's why it is called as the sickle cell anemia. Okay, so this is a normal RBC, and this is a sickle shape RBC. So that's why its name is as a sickle cell anemia. It is most common in tribal population or the person who is living in the forest area. So genetically, their RBC has turned to the sickle shape as to give it protection towards the malaria where mosquitoes are more. Okay, we will see in detail. Now, why sickle cell is called as a molecular disease? So here, if we know hemoglobin A is made up of 2 alpha chain and 2 beta chain. This beta chain is made up of 146 amino acids. So this suppose is 1, 2, 3, 4, 5, 6, total 146. Suppose this is a 1 amino acid and this is a 146 amino acid. So what is the defect with sickle cell? At the 6th position, this glutamic acid, normally it is a glutamic acid, which is replaced by the amino acid called as the valine. Okay, so what will happen? In the DNA, there is a nucleotide sequence like this. And according to that, mRNA is produced. Suppose A, it will form T. Against T, it will form A. Against C, it will form G. Against C, G. Okay. And here, in DNA, there is a normally that is CTC sequence which is replaced, and if CTC is there, normally what is produced? GAG. Okay, and this GAG will code for the glutamic acid at the 6th position. But in sickle cell, what will happen? There is this thymine, purine is replaced by adenine. Okay, this thymine is the pyrimidine. This nitrogen base is replaced by the purine nitrogen base. So pyrimidine is replaced by the purine nitrogen base, thymine replaced by adenine. So what will happen in the DNA? Instead of CTC, there is a mutation with CAC. And if there is a CAC in the DNA, then mRNA will form GUG. Now, you know that every codon codes for specific amino acid. So, GAG code for the glutamic acid, but GUG is coding for the valine. Okay. So, there is only one change in the DNA in the nitrogen base, and the amino acid is replaced, and it will lead to the sickle cell anemia. As you know, glutamic acid is a polar amino acid, but when it replaced by the valine, which is a non-polar, it is a hydrophobic, and so the solubility is decreased. Okay, so I have kept one picture. So this is DNA normally, and if this CTC, this is normal, if it is replaced by, this thymine is replaced by adenine, then mRNA normally it is GAG, but it is replaced by the GUG. GUG code for the valine, while GAG code for the glutamic acids. Okay. So what will happen in this patient? Suppose this is a structure of normal hemoglobin, that is oxyhemoglobin. If it is deoxyform, then there is receptor are there. Okay, this is deoxyhemoglobin, normal HbA. If it is sickle HbS in the oxy form, it contains a sticky patches like this because of the presence of valine in its globin chain. And the deoxyhemoglobin as it contains sticky patch plus receptor. And this deoxy HbS, the structure is like this. They will aggregate with each other. So this is a sticky patch. This has a hydrophobic pocket. So there will be aggregate and they will form the polymerization. Okay, and it will lead to the fibrous structure, and it will lead to the chicken shape of RBC. And normally the capillary size is around 3 to 4 micron capillary, and RBC is around 8 to 9 micron. But biconcave shape RBC can flexible and they will pass through this microcapillary. But because of the sickle cell, they will stick in the microvasculature. Because of the sickle shape, they will stick in the microvasculature and they will produce the block in microvasculature. And with the time, there is a blockage of the artery. It will lead to the infarct, and that will lead to the pain. Okay. So you can see this is the oxy normal hemoglobin beta alpha. There is this is normal, but in deoxy form there is a hydrophobic pocket or receptor is there. In oxy HbS there is a sticky patch. And in deoxy form, deoxy HbS, this is oxy HbS. In deoxy form of hemoglobin S contain sticky patch as well as receptor. So they will polymerize, okay, and they will form the fibrous structure. Okay. So this is sickle cell. This. So Mainly the sickle cell anemia may be in the homozygous form or heterozygous. What do you understand in by this homozygous? As you know, you have a one chromosome from your father, one chromosome from mother. So if father has a beta chain is defective and mother beta chain is defective in the sense glutamic acid is replaced by the valine, and father also glutamic chain is replaced by valine. The child got one chromosome from father, one chromosome from mother. So if both the chain if defective, it will lead to the sickle cell disease. While in heterozygous, one chain is normal while other chain is defective. Okay, so one beta chain is normal because it was normal, and other he got, so it is called as a sickle cell trait. He will normally live a normal life, but when the person sickle cell trait goes to the high altitude, he will suffer some problem. So what are the clinical features of sickle cell? So person have a lifetime hemolytic anemia. Why hemolytic anemia? Because sickle shape RBC has a lifespan around 70 to 20 days. Normal lifespan is 120 days. In sickle cell, RBC will be broken down, so more and more unconjugated bilirubin will be increased. So because of that, person will have a jaundice. He will have a painful crisis because sickle cell RBC will trap in the microvasculature and it will block the artery and it will lead to the infarction of the tissue. Person are more susceptible to infection because there is a autosplenectomy is there. So when there are some painful crisis, sequestration crisis, aplastic crisis, all are the clinical features of sickle cell anemia. Okay, and one of the complications is priapism, painful erection in male. Okay, and in many sickle cell patients, there is a avascular necrosis of head of femur. Yeah, these are all the complaint of the sickle cell patient. Now, how we can diagnose? Diagnosis with the help of solubility test as reduced hemoglobin. They are insoluble in phosphate buffer. So we take phosphate buffer, add dithionate powder to make hemoglobin reduced, and we add the blood sample. And if the turbidity is there, we can say that patient is sickle positive. He may be sickle trait or disease. Both will give this trait positive, and we can further differentiate with the help of electrophoresis. So this is normal. We can see this transparent. We can see the line through the solution, that is normal, but this is turbid, that is positive sickling test. Okay, again you can identify this is normal. You can see through the solution this, and here this is turbid, that is sickle positive. It is solubility test. One more is sickling test, where sodium metabisulfite is added to the solution, added to the blood, and we see after we keep the slide, and after some time we see in the microscope, and if sickle cell RBC are seen, then it is positive. Now we can confirm sickle trait or disease with the help of electrophoresis. So suppose this is the cathode side where we place the sample, and this is the positive side. So carbonic anhydrase, then HbA2, highest mobility in normal person is HbA, then fetal, then sickle, and HbC. So I will show some pictures. So this is suppose negative side, origin of application. This is the positive side. So adult hemoglobin will move highest, then fetal, then sickle, because in sickle glutamic is replaced by the valine. So hemoglobin S, as such, it is the positive charge. So it will not migrate towards the positive side. It will run slowly because it is a valine in it. Okay. So highest mobility will be the adult, then fetal, then sickle, okay, and then HbC. And this at the region of A2, this is A2 region, where you will find HbC, HbE, HbO, and HbA2. This HbO is present in Arab. HbE hemoglobin mainly seen towards the western east portion. Of India. HbC mainly seen in the African. Okay, so if band is there is at the A2 region, it may be HbC, HbE, or HbO in electrophoresis. While band in the S region, if there is a band in the S region, then if solubility test is positive, then it is sickle cell anemia, and if sickle cell is negative, it may be HbD or HbG. Okay, while HB lapore will move like little bit. Again, if you can identify, this is negative side, this is cathode, this is anode. So sickle, highest mobility of the adult. So if A and S, if two bands are seen, that is sickle cell trait. And if only sickle and fetal slight amount, there it is sickle disease. Okay. And this A and F band mainly in the cord blood. Again, if you can identify, this is negative side, cathode, and positive anode. So if there is only A band and some amount of HbA2, this is normal. But in sickle trait patient, there is A and S. Okay, two bands are seen. Now, if you can identify, this is negative side, this is positive, point of application is here. If is at the A2 region, if band is seen, that is mainly HbC, HbE, HbO. Okay, but here it was confirmed by HPLC that it is HbE, mainly seen towards the eastern part, like West Bengal. Okay. So if you can identify here, this is point of application. Here, this is carbonic anhydrase, this is A2. So if band in the S region, only that is sickle cell disease. Okay, this is normal. Again, normal. These are my control for A and S region. And the management portion of sickle cell. So in sickle trait, this person will live the normal life because 50% molecule are HbA, 50% is HbS. Okay, but we have to advise him to avoid at high altitude. Also, to the sickle disease patient, we have to advise to avoid at high altitude because there is a oxygen is less, so deoxyhemoglobin will favor the precipitation. Okay, and we also avoid for the dehydration, so always take plenty of fluids because dehydration, it will lead to the blood become viscous and it will precipitate the attack of sickling. Also, so that's why we have to say the patient avoid excessive cold, avoid excessive heat. Okay, and try to avoid rainy season, avoid rain, okay, and avoid any stressful condition, okay, avoid strenuous exercise also. And how we can manage the patient of sickle cell? At the time of crisis, we have to give oxygen, we can give painkiller, okay, we can give antibiotics. Now also hydroxyurea we can give, that will convert sickle to fetal hemoglobin, okay, and ultimately is bone marrow transplant or gene therapy in the future. Okay, now we see one case. A 3-year-old boy was admitted to the pediatric ward with complaint of pain in the abdomen, failure of the skin, hemoglobin was only 3 gram. The possibility of sickle cell disease was suspected, and test for the sickle cell disease was done. Hemoglobin was found insoluble at low oxygen solution. Electrophoresis showed that patient had only HBS, while both parents has HBS and HBA. So parents are sickle trait and children have a sickle disease. So write the primary structural defect in this patient of hemoglobin. So what is the defect? As in DNA, T is replaced by A. So in mRNA, GAG is replaced by GUG. So glutamic acid is replaced by valine at the 6th position of beta chain. Why the patient has anemia? Because of this defect, the RBC is sickle cell. It has a lifespan around 70 to 20 days. So more and more breakdown of RBC lead to the anemia. Mainly the hemolytic type of anemia. Why the patient hemoglobin was not soluble in low oxygen solution? Because at low O2, it favors the deoxy form of hemoglobin, as they will polymerize with each other and form the fibrous structure. Okay. While HBS moves slower towards the anode during electrophoresis at pH of 8.6, because HBS has a valine group. So it is not, while glutamic acid normally it is negative charge, so it will move towards the positive charge, but as it is replaced by the valine, sickle cell moves slower towards the anode or positive side, because it does not contain more negative charge. What is the biological advantage of sickle cell anemia? Because sickle cell will help to prevent malaria, because RBC are sickle cell and it will break down in 70 to 20 days. The malaria lifespan, like parasite life cycle, is not completed, and that's why it gives a biological advantage. That's why sickle's gene was inherited in tribal population or person who is living in forest side, and it will help in where there is so much of mosquito which will lead to the malaria. So sickle cell will give the advantage to prevent that. This is all about the hemoglobinopathy. I hope you like my video. If you like my video, please like my video, hit the like button, and please share and subscribe to my channel. Thank you very much for listening.